All right, welcome everybody. Happy Wednesday, day 15 of the Omer, entering week 3 and kicking it off with the next in our series of taboo topics. Welcoming Dr. Bryon Adnoff to present. He did a presentation to the Israel group that was going to go about expertise, and I asked him to share that with the entire.
Let's start it.
Have started? Yeah. Well, every time a dog.
So maybe some people should mute their microphones if they're speaking.
I got it. Yep. Thanks, Steve. Welcome. So here's Bryon, and thank you and welcome.
Yes.
Thank you. It's a pleasure being here. So we're going to talk about psychedelics. I understand that is a topic, hopefully. Let me give, and it'll obviously be informal. We have an hour and a half. Is that right?
Yeah.
Okay. So yes, it will be informal. I have slides. It'd be nice if I get through them. If I don't, that's okay. So let's see how it goes. If you have questions, just ask or comments. I'm gonna start out just giving a little background about myself. Let me start out with just asking who has had their own personal experience with psychedelics. Yeah, what a surprise. So at least in the people here, six, well, and me, so 6 out of 7 have raised their hand. Well, I'm sure Steve Lazar has not. I don't know about the others. So there's some.
What did you just say about me?
None, but it's also amazing how many people have, and that's why they're so interested in the topic. So I myself, I was raised to professionally as a Jew to be either a doctor or a lawyer. It comes as a surprise. And it wasn't until I had my own experiences with psychedelics in college that I really settled into medicine, because I was fascinated. I mean, there were really very pivotal experiences in my life. And being kind of medically minded, I was just fascinated in terms of how a drug could make me feel the way I did. We'll talk about that more. And so that's what I wanted to do. So I did go to medical school, and I got an MD and went to psychiatry because I wanted to study neuropharmacology, or the effects of drugs on the brain. And given that this was the 70s, and there were no more studies, period, about, I think, from 74 on, for many years of psychedelics, that it was a few decades before that kind of work actually got done. So I did actually land up doing imaging studies and looking at brain functioning in people with addictions, but not with psychedelics or cannabis or anything like that. But it's been fascinating to me to follow the field as the years have gone by. And I'm thrilled that somebody is doing it. And the technology is there to learn something at this point. I mean, when I was in medical school, I remember one of the hospitals in the town got a CAT scan, and that was really big news. And now we have really, really cool stuff. But anyways, that's how I came by it. And more recently, so I had some experience when I was much younger. And then recently, since I moved to Denver, I've had a few, one individually with therapists, and then 2 with Skylight Psychedelic in town. in a kind of sacred ceremony that's been very cool and much, much different than going in the woods with friends. So let me start off with psychedelics, and sorry, I have a poll. Okay. Yeah. So we'll go we'll go through a very brief history of before we were around. But obviously psychedelics go back a long, long ways. So what do we mean by psychedelics? It means mind revealing, soul manifesting, get in altered states of consciousness, auditory and visual hallucinations, deep introspective insights and personal growth. But what I think is key and what stands out and where much of the focus have been and interest is the mystical experience. A lot of different psychedelics. And we can talk later about what's the difference between these. But I think what's key is that most of them can bring us to the point of having a mystical experience, some more than others. Ketamine, not quite as much. MDMA, not so much. LSD, mescaline, psilocybin, very much so. Ayahuasca. So what is a mystical experience? And this is Roland Griffith put this together. Roland Griffith is one of the key folks in the field, or was. He died recently, and he was working at Hopkins, and I saw him talk when I was just starting out in the field, and well, he was kind of starting out in the field too, and his thing was benzodiazepines, and he kind of veered off into this field, but very early. So in the 90s, he was already starting to try to do these studies, which were very, very difficult to do at that time. I mean, they still are, but it was really difficult at that time. So how do you prove to an IRB, an internal review board, this is a group of people in any academic or hospital system that review grants to make sure that they're safe. So how do you convince them that a drug that's been used for 5,000 years is safe? It seems a little silly, but that's where we were. And so him and his colleagues went through the literature to look at all the mystical, everyone who described a mystical experience. I don't know, Moses with the burning bush, Buddha, and all the different religions and mystics, and try to pull together what is it that defines a mystical experience. Because when you're doing these kind of studies, you can't just say, did you see God? Did you feel at one with the universe? Well, actually, that is a reasonable question. They're all reasonable questions, actually, to put on a questionnaire like that. But you want to do it so that you are sure that what you are asking is what you're actually interested in, and that people understand what the question is. So any questionnaire should really go through this kind of rigorous process. So if you score a certain number on this questionnaire, that everyone's agreed, yes, that was a mystical experience. So there's unity, which I think is key, a sense of interconnectedness, that everything and everyone, all beings, the grass, the trees, we're all connected. It's got a noetic quality, a sense that the experience was a source of objective truth. 2 weeks before my first journey, I like that term better now, when I was in college, and I was preparing for it, not something people did then. My friends would just smoke a little dope and have a beer and, drop some acid. But I was, even back then, I was very thoughtful about it. I was already a sophomore, and I was talking to a sister of a friend of mine, and she had just tripped. And I asked her what it was like. She said, "You know." I said, "What do you mean you know?" She said, "You just know." And 2 weeks later, July 4th, I'm with the whole crowd at the fireworks, and I know, people that have known know what I'm talking about. You feel you have some truth of the universe that you have just realized. There's a sacredness. It's worthy of reverence, divine, holy, positive mood. It feels good, transcendence of time and space, and ineffability. Difficulty communicating or describing the experience to others. That's actually the part. Other terms that have been used, and this makes more sense as I talk later about the biochemistry of what, or the neurobiochemistry of what psychedelics do, the ego disintegration, ego dissolution. So the sense of me, myself, who you are, you lose that. So that's kind of just gone. And that's where the connectedness comes from, and that you no longer are this isolated thing, but you're connected with everything else. So as I mentioned, this goes way back. This is the Mayan mushroom from 1000 BCE, an Aztec mural. There's a lot of Christian iconography over 2,000 years with lots and lots of mushroom. And there's just reported use of this for thousands of years of different psychedelics. We'll come back later to the immortality. I think it's the immortality key. The Eleusis, am I saying that with the Greeks? The Greeks for 2,000 years would have this hike that went on for, I think, a couple hundred miles over several days. And it was, I didn't know about it till I read the book, even though this was around for 2,000 years, they did this. And it was key to who they were. And it is now thought probably likely that they were doing a psychedelic of some sort during that time. And this is just time while I'm showing mushrooms. If you haven't seen, who's seen the Fantastic Fungi? Couple people. Oh, it's great. You can get anything on Netflix. It's beautiful. I mean, beautiful in that the pictures are beautiful, done with great photography, but it really takes you through the history of the mushroom, particularly psilocybin. So this was not a thing in Western civilization until the 40s, 50s, really. Abby Hoffman, Albert Hoffman, he synthesized LSD in 1937. And he describes taking a little bit to see what it was like. And he took this bicycle trip home, quite literally, bicycle trip. And he describes just this intense experience riding his bike going home. And he told people about it, and a lot of people started using it. And it's weird to imagine people using these things. And that the psychopharmacologists, certainly in the 50s, 60s, people I knew that were generation or two ahead of me, probably one generation ahead. They were all doing these stuffs during this time as we were finding what these psychedelics were, and they would try them out, and this was just part of what you did. In the 50s, I can't see his name here and I can't see my notes. But there's this guy who went to Mexico. He heard about this woman who was kind of collected the mushrooms, and she was known in her village. And he went to her and promised he wouldn't tell anyone about it. And she took him through the experience, and then he wrote an article for Life magazine. So there were many things that led to it being popularized, but this is when it became, people started doing it a lot. For those of you who are familiar with AA, Bill W. started AA. He wrote the big book, 12 Steps. And he talked about the importance of spirituality to becoming in true recovery. And it could either happen instantaneously or it might take years, like it does for most people, to really reach a point of spirituality where it would really change you enough that you would be in true recovery. And Bill W. in the big book, or actually it's like a supplement to the big book, he talks about when he went in for detox, and he said there came this sudden experience in which it seemed the room lit up. It felt as though I stood on top of a mountain, that a great clean wind blew, that I was free. I mean, it was very much a spiritual, mystical experience. Now, at that time, there was what was called the belladonna cure to treat you for withdrawal in, I guess, the 30s. And he reportedly had been given atropine belladonna for withdrawal. And so there's always speculation, we'll probably never know, that what he was experiencing was a psychedelic trip, a pharmacologically induced psychedelic trip. And that's what gave him the experience. Now, around the same time, Aldous Huxley wrote Doors of Perception, where this was a trip he took. Aldous Huxley wrote 1984. No, big.
He did not write 1984. George Orwell wrote 1984.
But he wrote what did you say?
Brave New World.
Pardon?
Yeah,
Brave New World, wasn't
Brave
it?
New World. Thank you.
Yeah.
Thank you.
Yeah.
So he wrote Brave New World, and then he wrote, he did a I believe it was a peyote trip, and it was very intense, and he wrote a book about it. And that was, I believe, in 1954, and that really brought psychedelics to the common man. Everybody read it. Now, Bill W. and Aldous Huxley hooked up, in the old sense of the word, and they started tripping together. They had started a salon, and I won't read this quote, but basically it says, so not only were they both interested in it, but they were actually both very involved. And Bill W., he stopped drinking. He had a sober date. He never went back to drinking, but he had real problems. He smoked cigarettes like a fiend. He had real crippling depression, and he found the psychedelics, and I think they were mostly using LSD, very therapeutic for him. And he started to see the psychedelic trips as a way to treat alcoholism and substance use disorders. He resigned from the board of AA because it was obviously controversial, as it remains so, well, to this day, really. But this was something that the father of 12-step really believed in real time that this was something that was going to prove useful. So what happened? Over the 50s and 60s, there were about 10,000 people that went through studies of psychedelics. So there was a lot of serious study going on with psychedelics through 1974, both in the US and Europe. There was a lot of interest in it. They were looking at it to treat schizophrenia. In retrospect, kind of a bad idea, probably. Alcoholism, there were a lot of studies with alcohol and various other disorders. So there was a lot of interest in it. Then it got out into the hippies, and Timothy Leary was a Harvard professor when he first started, and then he was no longer a professor. But they were popularizing it as turn on, tune in, drop out. So it was becoming very anti-establishment, and Richard Nixon was kind of on the warpath and looking for a way to split the country. And the way he chose to do it was with the drug war, and it was very successful in that respect. This was a period hard to imagine unless you lived through it, between civil rights, gay rights came a little later, women's rights, drugs, Vietnam War. It was a tough time. It was a fascinating time. And I love this picture of Jimi Hendrix. I mean, this is how psychedelics kind of embedded itself in our culture. I mean, they're still recognized as psychedelic kind of themes. The music was all about this. So they started they instituted the Controlled Substance Act, CSA, where they rated all these different medications as from really abusable and no medical value to some abuse and a lot of medical value. And they put drugs like psilocybin, heroin, mescaline, marijuana, cannabis, LSD in the Schedule 1. So there was no reason to study it, no reason to use it, and it had really serious consequences if you got caught.
So that's been in the news this week with Biden, and if you want to comment on that, the reclassification of marijuana.
Yeah, so marijuana has been, and as a physician, I use the word cannabis because that's the name of the plant. It was actually in the Pharmacopoeia of the USA until 1937, when the Marijuana Tax Act was passed, which would tax it so severely that nobody could afford to buy it. And that's a whole different conversation, but it was made Schedule 1 in 1972. And so in the last week, it has been made Schedule 3, which is not that big of a deal, really. But at least not Schedule 1. The bigger news is that the Senate has introduced a bill that would deschedule it. And that would be a really big deal. Schedule 3, it still has to be approved as a FDA-approved drug. It still costs $1 billion to get a drug on the market from start to finish. And that's a lot of money. You go into a dispensary and there's dozens, hundreds of different products. Nobody's going to pay $1 billion to get any of them approved. So those are still, from a federal perspective, going to be illegal. The other news, I'm not sure how recent this is, but oh yeah, I think I saw this today, that the FDA is going to look at MDMA or ecstasy as, is that what you were referring to?
No,
Oh, okay.
no,
Um,
cannabis was.
is going to be reviewed by the FDA to be approved as a medication for PTSD. And so Rick Doblin, I mentioned Roland Griffiths, who started his work in the 90s, Rick Doblin, 88. Rick Doblin started it in about 85. He was kind of a hippie and had wonderful experiences with ecstasy, MDMA. I'll use that term, typically MDMA. Which is a drug that came along after LSD. I think it was synthesized, I don't know, 50s, 60s, but it became commonly used in the 70s. And what it does is it really allows one to feel empathy. So instead of the real strong audio visual hallucinations, and the strong mystical experience, it's more a connectivity with others.
Bryon, can I ask you a question?
Yes.
So I did MDA in the early 70s, never did the MA. Are you familiar with the difference between MDA and MDMA?
Yeah, MDA is, I believe, more like a classical psychedelic than MDMA.
Are they both from the same basic structure and it was just a further synthesis of the same?
Yeah, so, and they both are, I mean, the A is for amphetamine.
Oh, I see. So it's like MDA with amphetamine. And that's probably why I've never done it. It seems a little scary to me.
Yeah, but was it more amphetamine-like or?
No. I did MDA. You know, the Army developed MDA to drop on the Viet Cong, and we got some of it.
Oh, then I don't know. No, it's not what I'm thinking of. Was it bad? I mean, was it psychedelic?
It was mildly psychedelic, but like you said, very empathetic. I mean, you feel like you love everybody.
Oh, I guess it's hard to
They
fight.
called it the love drug in the 60s.
Yeah, MDMA, but I'm wondering about the MDA that you mentioned.
MDMA wasn't developed until the 80s.
Oh, okay.
Drop your weapons.
All right, yeah.
Hug instead.
Actually, this brings me back to a point I was going to make with, so what happened? Why did all the psychedelic research stop? And the lore I always heard was that it was because of the drug war, and because they just the NIH said you need to stop. We're not doing any more of these studies. But that really wasn't it, because you can study Schedule I drugs. I mean, it is possible to do it. All the time we've been studying THC, MDMA, psilocybin. These are all Schedule I drugs, and we have been studying them in this country. So you have to jump through a bunch of hoops, but you can do it. What had happened was a couple things. Number one, NIH started looking at all the psychedelic studies they've been funding, and they found that they were really pretty crummy. They weren't well controlled. The people that were studying them were just not doing it in a very with scientific rigor. And I mentioned the mystical experience questionnaire that was made a couple decades later. So they didn't have scales like that they were doing. And the second thing that happened was, as they were going through all this, it came out that the CIA had been giving large numbers of soldiers psychedelics to see how they would respond. Now, for those of you who had undergone this experience, it could be beautiful, but you know you've taken a drug. If you didn't know you had taken a drug,
Oh, geez,
it would be,
without their knowing.
Yeah.
oh, yes. This is the CIA.
Yeah.
And I remember these headlines. And what I didn't know was the NIH said, we're not touching this stuff. Just forget it. And they didn't until very recently they started. But most of the research that has been done over the last couple of decades was privately funded. It was not funded by NIH. They finally, within the last couple of years, they started to fund it. But so now they can say, yeah, look at we're doing great stuff.
Oh, it's VA also. The
So
VA.
if I could interject again, if you don't mind, the CIA and the Army were doing dual experiments in the 60s.
That had a
They were doing experiments, like you said, on prisoners where it was unknown, but they were also doing experiments where people were invited from the universities, and people like Jerry Garcia and Robert Hunter and Timothy Leary all participated in those experiments, which is basically how it got started in Haight-Ashbury, took off from there.
This is the CIA?
Yeah, they were doing the secret experiments in the prisons, like you say, where people did not know what they were taking, but they were also then inviting kids from the university to participate in the experiments, and they didn't know what they were taking.
Oh, okay. And I'm sorry.
So, like people like Jerry Garcia and Robert Hunter and Timothy Leary all participated in those experiments. Ram Dass participated in those as well.
Cool. Go ahead.
The VA funded some because it began to have hopes for PTSD. So they started funding some outside of.
Yeah. And so that's been approved?
Well, they were doing it early now. They were doing it before.
Oh, they were
That's how-
doing it.
That's how they got some of the studies that got them opening up now.
Okay.
Yeah.
They've been fighting it.
Yeah.
So maybe, and Rick Doblin, who started MAPS in order to do these studies, these guys said who really came into it in the 85, 88, with the idea, okay, I need to take this through the FDA process. If I'm going to make this a medicine, I'm going to have to learn how to do this. And he went to grad school. I think he went to the Kennedy School of Public Policy, got his master's with this in mind. And he is just, I've watched him through his career, just, start raising money very thoughtfully and starting with small studies and getting bigger and bigger and bigger. So what do you start out with? How do you pick LSD, psilocybin, MDMA? And he thought MDMA, number one, it's probably the least intense. It had been used the most therapeutically. And then what are you going to try it out for? Well, who do we care about? Well, we're not going to do it with addicts because no one cares about them. And we care about our first responders. We care about our veterans who have PTSD. We care about people who, through no fault of their own, have experienced trauma. So it was a great idea, and it's worked. So following 40 years of working on this, it's now going up for approval. Judith?
Yes, thank you. You're bringing back memories. In the late 70s, I was a research associate at the University of California, San Diego. And we were doing a lot of drug studies, including cannabis in the late 70s. And the joints, so to speak, that we got to use were from the feds. I mean, they were like these fancy rolled professional looking cannabis things. And I wasn't involved with the cannabis studies. I was involved with other drugs, and they weren't doing psychedelics in that era. But so I'm not sure what the purpose of those cannabis studies, how they framed it. But I just thought it was an interesting. That was probably 77.
There were a lot of, that's interesting. There were a lot of studies going on with substances that were being misused. And there were laboratories, there was a famous one in Hopkins, where you just put people, you got permission to get these drugs, and then you gave people access to them. Number one, to see how they felt, so you could, in a very methodologic way, get a dose response, how much makes you feel a certain way, how you tell one drug from another in terms of they develop questionnaires, so we can tell if it's heroin or cannabis or amphetamine based on the way it affects people. So they and how hard will they work for a drug? So you give them you give them tokens, and how, if they give them, you can have $10, you can have another hit. And so they would take people that were already using, and maybe they needed a place to hide out for a couple of weeks in the lab, and give them access to drugs.
Well, interestingly, we had folks coming from all over California who heard about these studies. And we were also doing Ritalin studies that were very popular. So it was a different era.
Yeah. They still do them. They still do them.
Yeah.
Okay. This is a little aside, but it's something I'm involved in. I'm now, I didn't talk about my career since I retired, but I retired from doing what I said, the imaging studies and writing and speaking about addiction, to what's been my passion for the last 20 years, which is drug policy reform. And I'm now president of Doctors for Drug Policy Reform. So this is the prison population, period. This is what happened to the prison population in this country because of the war on drugs. And it was very successful. I mean, people are still using drugs. We lose 100,000 people a year from drug overdoses, but the drug laws were made to disenfranchise and incarcerate people of color. And it's done very good at doing that.
This past March, so I was in Atlanta, and we did a side trip to Montgomery, and there's a brand new museum called the Legacy Museum, which is like gone to school in the Holocaust museums, and it's called Legacy Museum from Slavery to Mass Incarceration. And it tracks the parallels between those two institutions. Very compelling experience.
Hey, try to get there. That sounds cool. Okay. So these just give some dates about the Renaissance. MDMA. So MDMA, it got popular, as I mentioned, in the 70s, 80s, and then it became Schedule I. So it was being used a lot in therapy. MAP started in 86, and actually, it's a friend slide. I don't know what the FDA approved study on DMT. I don't know about that one. Now this one in 94, American Indian Religious Freedom Act, was very important. And this protected peyote use by members of the Native American Church, and recognizing their cultural heritage, and that this goes way back for Native Americans, and that they would be allowed to use it in that setting. And this is rearing its head a lot now, and we'll come back to it if I remember or bring it up. But as we are developing in this state, in Oregon has already done so, we passed the Natural Medicine Act, I think it's called, And that we, I guess a year and a half ago now, we legalized or made it, it's no longer a crime to possess or use psilocybin, psilocin, DMT, or mescaline, which is the psychedelic that's inside of peyote. Anyone know why we can't use peyote? There's very little peyote, and it's a big risk of all this white people going through the desert and picking it. It's not like psilocybin. Anybody can grow psilocybin, but peyote is very much at risk. So that's why the mescaline that can either get pulled from or synthesized. Anyway, so they have been decriminalized, they've been legalized, and that we're starting natural medicine clinics where you can go and first start use psilocybin in a protective environment. And so who's going to be allowed to do that? How do we credential people to do that? Does it matter whether you're already a doctor, a psychologist, or social worker? So indigenous populations are saying, I learned from my father, I learned from his father, going back multiple generations, and I'm the leader in our tribe. You're telling me I need to take your course? Well, okay, on tribal lands you can do it. We have a large tribal community in Denver. I can't do it in Denver. So these are really tough questions. And I don't have the answers. Nobody has the answers. They're fighting it out. But it's a problem. And talk about misappropriation of a culture. This is us taking something they've been doing for thousands of years and bringing it into our culture and turning it into, well, like we always do, a big business. So there's, thousands of billions of dollars going into psychedelics, going into cannabis, and making it big industry. Oh, this is interesting. The scientific papers. You can see the scientific papers on psilocybin from 50s, peaking at 1970s, and then crashing, and then exponentially rising over the last few years. So I mentioned why MDMA was chosen by Rick Doblin of MAPS. Psilocybin was chosen by Roland Griffiths at Hopkins to use as a therapeutic agent. It's relatively short acting, so it's a couple hours long, maybe a little longer. You definitely get a mystical experience. It's been around for a really long time. And now you hear people jumping out of windows with LSD. You just don't hear about people jumping out of windows with psilocybin. It's not as intense. And it's been around a long time, and we know it well. And I heard David Nutt in England said he started his studies with it because the politicians can't spell it. It's PSILOCYBIN. So there's some key things to know about if you're going to go on a journey, things to consider. One is where your drug is coming from. I mean, now you can actually get it sourced pretty well, particularly in Colorado, where it's essentially legal. I mean, you can grow it. You can't buy it. So for instance, when I did my sacred space ceremony, it's at the doctor's home. There's lots of guides, very well protected. And she gives us the psilocybin, and then I pay her for use of the space and for overseeing it. So that's how it works. Ketamine is the only one on here that is actually legal on the list, and it's used a lot now, all over the place. So what drug are you getting? Where's it coming from? Are you sure you have the right drug? And how much are you taking? And it really varies so much by dose. I mean, the last 2 times I've done it in this ceremony, they come by after an hour and they say, is the medicine calling for you to take more? And I say, the medicine is calling for me not to take any more. I am just fine. And how are you taking it? Are you inhaling it? You're swallowing it. Ketamine you can do IV. But probably more, what's talked about more is the set and setting. One is the set, how are you doing? Where are you? Are you in a space that you should be doing something like this? Are you in a good space? What are your intentions when you take the drug? And obviously when you're in college and just doing it, I'm going out for a good time. Well, that's an intention, that's fair. And then setting is, where are you and who are you with? And it's weird how early I really started in this field. When I was in college, I think my second year of college, I would work for Drug Help, and we had a little office space, and people would call up, they were having a problem. And people that were having a bad trip were the easiest ones because they weren't in medical danger. And you would just say, I'm going crazy. No, you're not going crazy. It's just a drug. Where are you? Are you with somebody? Okay. And often they're with somebody, but their friend is telling them, oh man, you're freaking out. This is terrible. I don't know if you're going to come down from this. Get another friend and be with somebody safe. And it's a pretty night out, isn't it? Yeah. Just go out, look at the stars. Oh yeah, I can see them. Yeah. And then they're good. And so it's easy to get going in a bad way, but it's relatively easy to bring somebody back out of it too. You don't have to give them medication. Medication's not even going to help. I think if you bring somebody to the hospital, they might give them something, but you really don't need it. You just give them a quiet space and support. But those are really, really key. So this is some of the data that started coming out of, I think this is probably from the Hopkins studies. So 1 month after the high dose sessions of psilocybin, 78% that it was among the top 5 most personally meaningful experiences of their life, 83% among the top 5 most spiritually significant experience of their life, 94% increased sense of well-being or life satisfaction, moderately or very much, and 89% endorsed positive behavioral change. This is really amazing. And these probably were healthy controls. So that's what they started out with. 14 months later, personal well-being or life satisfaction were dramatically higher. And they also had controls. So some people took it, some people didn't. And being able to compare those 2 groups was very important. So this is the kind of thing the data started showing. This is positive change scores. These are community observer ratings of volunteers' behavior. So these were just asking people, you know, from what you, maybe someone that worked with them, what have you noticed about this person? And so 1 month, 14 months later, they're reporting dramatic differences in these people. Oh, I just like this. Ayahuasca, is that familiar term? It's becoming more so. This is a plant that's been used a lot in, it's 2 plants actually. In a combination of them both. One of them has DMT in it, which is a very, very potent psychedelic, but it only lasts about 15 minutes. And then it's combined with harmaline, which has an MAO, which blocks the degradation of the DMT. So it lasts for a very long time, many hours. So people go to shamans, they'll fly out, they'll get a Jeep to a small little town in Peru, and then drive out another couple hours to a little tent in the middle of nowhere with a group of people and do ayahuasca with the shaman. You know, what could go wrong? And usually nothing does. So there's actually like a trip advisor, there's Aya advisors that gives you retreat reviews. And now they have them here. And even though it's not, I guess it would be legal here because it's got DMT in Colorado, but other places it doesn't. But these are used a lot. I don't think the police bother you much anymore about this kind of thing. So these drugs are being considered and being used in treatment for just about everything now. PTSD, depression, end-of-life anxiety. So it's really good for that, for people that are going to die. Well, that's everybody, but they're not you. You don't need it. You're good.
Denial is another drug.
So end-of-life people that are facing the end of their life soon, and they have this experience of interconnectedness, and that they see that there's something else, that they're not alone, and it can really change their perspective. Depression, anorexia, OCD, and then all sorts of addiction problems.
Can you go to the depression and Alzheimer's? What do you know about that?
I never even saw that.
Whoever asked the question, could she speak louder or could you repeat the question?
Oh, why don't you repeat it?
Well, I don't like the question. I don't have any idea. It's on my slide. Sherry asked about depression and Alzheimer's. And as I said, some of these slides I got from her friend, and I hadn't really seen that there. And I don't know. Anyone heard anything about that?
I think there's a lot of depression and Alzheimer's disease at the onset, when you realize you have Alzheimer's disease. And then once you pass beyond that, remembering that you have Alzheimer's disease, then you no longer need it. But that first part is, I think, and there's a lot of suicide, I think, or contemplation of suicide for people who've been diagnosed with Alzheimer's disease.
You know, I wonder, because you would, by definition, from what you're saying, if you're depressed because you're aware of the loss of cognitive functioning. And if you are able to have this experience of connecting with something else, so that even though you may not remember stuff, you're still part of a larger whole. And that may have a real therapeutic value.
But you know, in Alzheimer's disease, Descartes ruined us all, I think, because he said I think, therefore I am. And if I don't think, or if I'm not able to use my brain cognitively, then do I not exist? And so I think that this would be a wonderful way for Alzheimer's folks, because one of the things that happens with memory loss, I think, is that people, the beautiful thing in being around people with Alzheimer's disease, I know that might seem like not possible, but the beautiful thing is that they live in the present. So I think it sort of makes me think, oh, that would sort of help them get over that point so that they can be present without worry.
Yeah, thank you.
I wish. Well, my mother had Alzheimer's disease and lived with us for 12 years and died in our living room. So I would have loved to have had that available.
Yeah. Go on. This is some of the data. And what this mostly shows, each one is showing the mystical experience questionnaire, the scores, and their subsequent symptoms. So the one on the left, I can't make it out in my small thing. Motivation. Motivation to not drink would be the y-axis. And then their score on the mystical experience questionnaire probably is the x-axis. And it shows that in people with, I think it was cocaine addiction, if it's Descartes is the author, that the more they got ketamine and the stronger the mystical experience, the more motivation they had to stop using. In the one in the middle, it shows that this is looking at drinks per day at various time points after the infusion or after the psilocybin. And again, the more intense, the more mystical the experience, the less they drank. And this has since been published. These are blinded, but the group that got psilocybin drank much less than the group that got, I don't know. I'm hesitating to say whether they got some kind of placebo. These are very difficult studies to do because what do you do for a placebo? You know, pardon?
Then we would have to have some kind of an effect to them, right?
The
placebo.
Yes, because I mean, usually what you take a pain reliever and you don't really know whether you got it or not unless it decreases the pain. Well, placebo can decrease the pain. If you take a pill and you seek God, you know you took the pill. A sugar pill is not going to do that. So what do you give? Well, some people use Benadryl because it's got some sedative effect, but there's no good way to do it. In fact, I would make the argument it's not even ethical to give somebody a placebo because you're denying them treatment and you're putting them through a study for no reason because you're not going to learn anything from it because the placebo's not really a useful placebo if you're comparing it to psilocybin. One that you can do, some studies have used just a very low dose. So a low dose, but there's microdose in this.
And that's the one they have here in that middle graph is the dosage is less than what, 0.25. So you can see the difference in the blue graph right there. The is the low dose, and then the red is more than a quarter dose at a significant consistent decline in the drinks per day.
All right. And the other one, thank you, Jamie. The one on the right is similar mystical experience versus long-term not showing up with cotinine in your blood or urine, which is from smoking. So these are in smokers.
I'm involved in a study right now for advanced cancer patients at Anschutz, and it's also in conjunction with NYU. And I just had my dosing in April, and it's a double-blind study, and the placebo was niacin that they used.
Oh, and what is the active drug?
Psilocybin.
Really?
Yeah. It was quite an experience.
Well, niacin has no effect at all.
You flush, yeah.
Flush.
But
Oh.
I got the real thing. I didn't get the placebo, so I knew right away, like you said. But
Or as one patient once said to me, or else it was a really, really strong placebo.
or else I'm really crazy. Yeah.
Was it helpful?
I'm still kind of teasing that out. Yeah. It's a very controlled study. I was in a small room with 2 therapists. There was an oncologist, there was a physician, there was the 2 therapists, the pharmacist, and the pharmacist is the only person that knows for sure if I got the real thing. Well, I feel like I did. And then there were the 2 people that are coordinating the study. So there were 8 people involved in this. And the whole time I was in a real small room with the 2 therapists, I felt very safe. I had a blindfold on. They covered the mirrors in the restroom. I had headphones on. They didn't want any. I would have loved to have been outside rather than in this little room for 8 hours. But I do have the opportunity, because it's a double-blind study, and the people that did receive the placebo, they want to try the real thing. So all of us have the opportunity to have another go at it.
So that's a long time, 8 hours, because
It was a very long day.
you're not feeling the effects for near that long, are you?
Probably 7 of those hours.
Really?
Yeah. They wouldn't let me go home until they knew everything
Yeah.
was through. And yeah, I had to have
What
a
was the
driver.
purpose of the study?
I have stage 4 cancer.
Okay, so, and what are they measuring?
Just quality of life, peace of mind, less anxiety,
Okay.
that kind of thing.
Awesome.
Yeah. And it's a big ask to be in a study like that. There's I have a lot of Zoom calls, a lot of follow-up calls, a lot of paperwork. I had to do like this 14-page survey. Yeah.
And the 2 therapists, it's a real issue because is one a man and one a woman?
They were both women.
Okay, so I think they were requiring that for the MAP studies, the ones I mentioned earlier with MDMA, to assure sexual boundaries aren't crossed. And from a economic perspective, you can't take 2 people, expect 2 people to sit there in a room with the patient for 8 hours. When they started the natural medicine clinics in Oregon that I was talking about, they were charging $3,500 for a single session. Who can do that? And with ketamine, presently, they're many hundreds of dollars per session, and you need several sessions. So it's great that we're doing this, and this, of course, is a research protocol. But with MAPS, when they approve it, they're going to approve it with the MAPS protocol, which is what was studied. And so you can't get a doctor to prescribe you the MDMA if you're going to go to your own therapist and have just a single therapist do it with you. But these studies need to be done. Thank you for sharing that. Be interested how you do. And then there's also part of what they do now. I didn't mention it in the setting, but you have a introductory introductory session where you learn about it,
Oh, I had a lot of
introduction.
A lot. It started in January and I wasn't even dosed until April. So there were a lot.
And then you have your integration
Yeah.
afterwards.
There's 8 of those. I have eight
Oh.
sessions. Of
Wow.
The integrative session.
For one trip.
Yeah.
Wow.
That's being done with a big grant. Huge grant.
Yeah. Yeah. I'm glad they're doing that, and thanks
Yeah,
for participating. That's how we learn stuff.
I feel very fortunate that I was able to be a part of that.
Do you know how many people are in the study?
I don't know.
I want to come back to that. I want to talk, so what I want to talk about is, I don't have time, the biology of it, but that's kind of what I think is very cool. Not as much as I used to, but I still do. And then what this has to do with us as Jews and our understanding of Judaism. So the classical psychedelics I mentioned earlier, like LSD, psilocybin, peyote, hit the 5-HT, the serotonin that you probably all heard about with depression, the 5-H2A receptor. So that's a specific type of serotonin receptor. And we've known that a long time. And the areas of the brain, you can see the outer part of the brain here is red. So you inject something that will bind to the serotonin receptors and it shows up red. So you can see they're in the outer, the cortex of the brain. And then this inner part, oh, let me do it like this. The inner part here, that's the anterior cingulate. And we'll come back to that. So there's a lot of 5-H2A, 5-HT2A receptors there. Now, we used to think about the brain as disparate structures, but that's not really how it works. There are networks in the brain that talk to each other. And I love this slide because it shows the network of Republicans and Democrats and how they vote. And it used to be a really highly connected network. And then you see in 2002, it starts splitting apart. This is 2013. And I imagine now there's like almost no overlapping votes. So now you're talking about 2 really distinct networks, but each network is made up of lots and lots of people. Okay, switch for a moment to the default mode network. Now, this is one of the networks in the brain. So we have, for instance, a visual network, auditory network. Salience network is something grabs our attention. We want to be able to have all the parts of the brain that need to go into action. They need to do it immediately. So they need to talk to each other in a very quick way. The default mode network is the area that lights up when nothing else is lighting up. It took a long time for us to figure it, some folks figured out. Well, we always see it decreasing there. Well, that means it was in high. This is the part that's you. This is the part that lights up when you're thinking about yourself or remembering something. So if they're having you, tap a button and you can see, so, okay, so what part of my brain is lighting up when I'm pushing my right index finger? Well, if you stop doing your finger, the default mode network lights up. Well, notice these are where there's a lot of 5-HT2A receptors. So, and doesn't it make sense that this is like the ego? This is yourself. This is you that the 5-H, that psilocybin is going to attach to these areas and activate it. Oh, and this is how they're hardwired. So this is the white matter. The green lines here are the white matter that connects them. So you can see how hardwired these regions are. So they can talk to each other very quickly.
That's why it feels so good to be narcissistic. Right?
Authentic.
You have all these pleasure receptors in the part of your brain that's identified with ego, right? That's the.
Well, oh, that's what, I would not call 5-HT2A receptors pleasure receptors. Much different.
Then, but they're serotonin receptors.
Serotonin is actually more kind of to do with depression and anxiety than.
Okay.
So when I think of pleasure receptors, I think of dopamine,
Okay.
for instance. And that's in a much more primitive part of the brain. It's not in a thinking part of the brain. I'm glad you brought that up. Okay, so here you can look at the blue is where blood flow goes down. And this with fMRI, it doesn't matter. So you give psilocybin, and you see there's actually a decrease in blood flow in these parts of the brain. Well, I thought it was supposed to go up. And if we look at that green spot, the areas of the brain, when that area, so this is a little in front of the anterior cingulate, but it's the same general area. If we look at what that part of the brain connects to, so when it goes down in blood flow, I'm sorry, this is with saline. And what you see when someone gets saline, you see, and they're just lying there, you see activation of these, the anterior cingulate and the precuneus, the back part, those two areas where I was pointing out that they're connected to each other. With psilocybin, you don't see the same thing. So essentially what happens is they're no longer coupled to each other. They're not talking to each other anymore. They're kind of off on their own.
The front one and the back one.
Yes.
That represent you or
Right.
your default mode. They're uncoupled.
Yes. And the more they're uncoupled, the more you have this ego disintegration. Now, this is a very cool slide, but I'll have to explain it. So this is a normal brain, and here are the various different brain structures. And each different color is a network. And you can see they're connected to each other. You have lines connecting. So when one goes up in blood flow, the other one goes up in blood flow. So you can match and see which ones are talking to each other. Now, this is under psilocybin. What you see is actually there's the same number of lines. But instead of the auditory network connecting to the auditory, one structure talking to another auditory structure, it's now talking to the visual structure, or the default one network, or the salience network. So you have all these parts of the brain talking to each other, and they usually don't talk to each other. Now, if a lion comes out and you're in the jungle, that's not a good place to be, because you need to be able to respond quickly. But if you're in a safe place at a ceremony, then it's cool. So this is we talked initially about the interconnectedness, how it makes you feel interconnected with each other, with the universe. And it's so cool that that's what's happening in the brain.
It's fun.
So it increases the neuropathics, like you have a whole new array of neuropathways that are going in different courses than they're typically.
Yes. Yeah.
And is that just during the journey or?
Yes.
And then it goes back to the way it was?
We don't know that. My guess is what happened is that it kind of eases it a bit. And so that's right. I just heard this. With OCD, obsessive compulsive disorder, you probably have these pathways that are stuck. And so you can't get out of this loop. And that's why you keep having these thoughts and you keep having these behaviors. So it loosens them up. And then when they come together, maybe they're a little bit looser.
Do they know why the number of drinks would decrease?
The number of what?
Drinks would decrease with a mystical experience increasing?
I think it would be what Bill W. would say from AA. Once you have a spiritual experience, you look at things differently. Why am I drinking? Because I felt so alone. I felt so miserable. Because people are doing all these things to me. Well, I just looked at the world in a completely different way. Maybe that's not how things are. I might need to look at my life differently, look at my family differently, and look at my behavior differently. So it's the kind of thing you do in therapy, but you do it really quickly. So just like a spiritual experience can take, you go into a monastery for a couple of decades and you start to have these experiences.
Right.
Which brings us to the Judaism part, but I want to wait for Jamie to come back to this. So I just think that the neurobiology data is just fascinating to date. I love pictures that maybe show us something we knew anyways. But having a mechanistic understanding of it, I think is very helpful, especially to our Western minds. So what does this have to do with Judaism? I think there's two things. One, do we come from this? This is what happened with the burning bush. I mean, we don't know all the plants that were around back then. And all these mystical experiences can more easily be explained by the use of psychedelics, and not just Judaism, but all religions. And all religions have these kind of things in them. I don't know about all religions, but because I don't know all the religions, but they're very, very commonplace and they're very similar. The other thing is, can it help us understand Judaism now? Can it help us understand the teachings in a different way, rather than having to go off and, contemplate all these things and the Kabbalah, I think, is the best example of where did this come from? Things that make, to me, very little I know about it. And one reason I know so little is the little I've heard, it sounds silly. And it sounds just mystical and I can't wrap my head around it. Well, maybe having this kind of background, number one, was this and there's very little, if no evidence to suggest that the psychedelics were involved with our forefathers. But if I did psychedelics and then tried studying the Kabbalah, it may make more sense. So I'd like to just leave that open for discussion.
That wacky tree of life, it's a psychedelic plant. The tree of life, I mean, if you think of it as a plant or a natural substance.
Yes.
You can think of, and also you can think of the different sephirot as going from connecting one part of your brain with another, and if they're all connected, then how nice that would be.
Yom HaTzmaut coming up on Monday, the Tel Aviv book and the work on, and you want to mention a little bit about that? The work in Israel, some of these studies, and
I don't know, do you,
I was thinking of what you presented in terms of, to the Israel group.
about the cannabis?
Mhm.
Actually, let me talk, should have read more about this, but because this just came up, that actually there is, someone just introduced me to a group in Israel that's doing a lot of this work with psychedelics. So they are very big in this, and particularly for trauma. And in fact, my friend who's very into the psychedelic movement, she actually went there, and MAPS is looking to do work there with MDMA, but people traumatized from, I mean, think of going to a rave and experience going and having the time of your life with all these people that you're meeting, and then all of a sudden watching them slaughter in front of your eyes, while you are tripping, which I imagine a sizable, if not most or all of the people there were. Could psychedelics then be helpful to come to terms with that in some way? Jamie's talking about I'm stopping because I always got his name wrong. Milosh, can you remember the guy? The guy Miloshim, I'm saying it wrong, but he is the guy who in Israel who found the receptor that THC from cannabis connects with, and the chemicals in the body that bind to these receptors. So he started our understanding of the endocannabinoid system. And Israel, a lot of the key work that has come out on the endocannabinoid system has come out from Israel. There's
So all these college kids who are protesting divestment from Israel, they don't realize that the whole THC and science, so they came from Israel, and they're not calling the divestment.
I read this book, The Sacred Mushroom and the Cross, in college. I read a lot of books on psychedelics, so it's not as weird that I'm giving this talk 10 years later, more than that, I guess. The Sacred Mushroom and the Cross was about the idea that people couldn't talk about psychedelics. So all these terms like Jesus, if you look at the Aramaic, it's actually code word for a psychedelic plant. And I don't know how I read 100, 200 pages that talked about this, but I remember asking my rabbi at the time about it. He didn't know about the book, but he just said it was bullshit. And literally that's what he said. But I've since learned, because this book is now being talked a lot about again, that the guy who wrote it was one of the scholars who was called in to study the Dead Sea Scrolls. So he was not just some like crazy guy out there. He knows this stuff. It was a fascinating idea. The immortality key was the book I mentioned earlier by Bryon, and it's been, if you read in this area, it's talked about a lot. He was making the rounds a couple years ago on all the talk shows about this. And he's the one who was looking to try and understand if the Greeks were actually using psychedelics from way back. And he actually was looking to see if psychedelics were used by Christians along the way as well, and found some evidence of it, but nothing strong. And they did find, I guess, not too long ago, a year or two ago, they found some cannabis, like from hash, on an old altarpiece, Jewish altarpiece. Did you have thoughts about just understanding Judaism with the use of psychedelics?
Well, in terms of the state of prophecy, right? Excuse me, leaders in the community sort of downloading God's word, right? Isaiah, Jeremiah, Ezekiel, they have these, Ezekiel was the vision of the dry bones and resurrection, just these, might sound like Kabbalah to you. That there, there's been a lot of speculation around how they induce these states. And they can be induced through meditative techniques and different forms of, transcendental, cultivated transcendental states through chant, through music, through core meditation, through ecstatic dance, and through chemical means. And those are, they were considered all to be part of the mix. I think, there's not like in Judaism that I've seen in Jewish culture, a reactivity to the LSD movement, and there were Jews involved, and so there wasn't an inherited anxiety about engaging that. And I think that's from that history of just seeing that as among the tools to help expand our consciousness. My own experience, transformative LSD experiences when I was in college, and coupled with meditation, and then having an even more transformative experience in meditation, that if you can do it, that they're just two different pathways to the same form of consciousness. But I didn't follow the chemical piece because I found more profound experiences through meditative practices than through chemical inducement, LSD or ecstasy or mushrooms. But I for one, if you can, it takes a lot of discipline and practice to cultivate a meditative practice, or chant practice, whatever form of. So if you can shortcut that work and get the healing and awareness, through carefully controlled substances, I think we should be celebrating that. Yeah. And I have family members who are doing ketamine and having that be transformative and powerful. So yeah. The other book I would mention, I was just going to look up the title because I couldn't remember it exactly, but Michael Pollan's new book, How to Change Your Mind, or How to Change.
There's also a series on Netflix. Yeah.
So, and he's the founder of the food movement, and he's Jewish, and is also, that's when I talked to, I mentioned a couple people came up to me, parents in the Hebrew school program. We had our last day of Hebrew school, saying, "Oh, I was really glad to see you were doing this program tonight. But sorry, I can't stay." But they talked about that book. Two different people referenced that book and how it was impactful for them. And
They talked a lot about the, the peyote, ceremonies and the native folks, indigenous folks. And the use of that and the scarcity of the peyote. When you asked that question, why? I was like, oh, it's back there somewhere from that Netflix show, but I couldn't quite access it. But it's really, he does talk a lot about that. And it's really good.
It is,
There's a, Bill Huron has his hand up. Do you ever take that question? Bill, go ahead and unmute. That's it. Yeah.
Hey, hi. I just wanted to also recommend on Netflix Fantastic Fungi. If you haven't seen it, it's definitely worth seeing. And I also just wanted to offer up, so as a I've been in this since 2018 to deal with lifelong depression and PTSD. And it's a game changer. But as far as this whole discussion of like you could take a bag of fungi and go in the woods and come out a changed person, but to sustain that change you need a lot of support, and so my particular path was to go underground, because this whole even though the drugs all went Schedule 1 in the 60s, this whole practices and world around psychedelics and spirituality and mental health just continued. But if anybody has any curiosity about it from the perspective of somebody who's kind of gone through it for mental health purposes, but then has kind of stayed in it as a support to spiritual practices, I'm certainly willing to talk about it. And I think that the observation that there's many ways to get to the same place, and that's why the book that I mentioned in the comments was pretty phenomenal read. This was just like kind of doing it on steroids in a way, but also necessary because I was in a very dark place when I started. I don't know if that's helpful at all, but
yeah, very much. Thanks, Bill. Yeah, so that's a good place to end it. We're at time.
Awesome. Well, thank you so much.
Oh, can you say goodbye to everyone?
Yeah, thank you. What's that?
Oh, I just closed them up.
No worries. Thank you, friends on Zoom, for joining us. So, sorry about the sound technical, but hopefully you got the gist, and we'll make this available, the recording, for those who came late and you want to share this with other folks. We'll make that available through Elizabeth. And in terms of upcoming things, so we have
June 19th, we have Talking Transgender. Please, everybody, come back and join us for that lively conversation. And then in July, we're going to do the How Did We Get Here? And I don't know the guys.
So Rich Levine and David Froman are going to talk about, as part of this 50th anniversary, this sort of pivotal portion of CBE's history where we decided to build a building, hire a full-time rabbi, and affiliate with the Reconstructionist movement, all within 5 years, essentially. So they're going to be talking about that
in July,
that part of our history. And then I'll be doing a series or two on Reconstructionism.
Yeah, 101.
101, yeah. And yeah, so and then
I hope you'll also do something on the Kabbalah. The Kabbalah. I hope you'll also do something on the Kabbalah.
Also do something on Kabbalah. So we can work on that. If you want to take something Kabbalah related to that, I come on Friday mornings to the morning meditation, where I do little bits of Kabbalah every week. So that's also an option on Zoom.
Thank you.
And then on Monday is Yom HaAtzmaut, the Israeli Independence Day, the anniversary of the founding of the State of Israel. Obviously, a live and challenging topic right now, and Sherry's helping to, and Bryon are both helping to put together a musical piece and try to get out of our heads a little bit, and may have an easier time holding the complexity of that situation in a different part of our brain than we usually engage. So there's a bit of that, and on Monday at 7. And then on Friday night next week is the Shekhinah Shabbat. So an all women's led Shabbat service using music compositions that were created by women. So please do come and support the beautiful music you heard rehearsing. We're members of CBE who will be.
Yes.
Hmm?
Men too are welcome.
Oh yeah, everyone is welcome to the service, and please come all the more so to support the women who have stepped up to lead us. So thanks again, and thanks for the participation, engagement, and personal sharing. We'll, please keep confidential what people have shared. Obviously the insight you take away to share, but not associated with any particular person who may have shared medical details they weren't intending to make public. So thank you, friends. Have a great night. Oh, count the Omer with me.
Sure.
Baruch atah Adonai Eloheinu melech haolam asher kitshanu b'mitzvotav v'tzivanu al sfirat haomer. So you can repeat after me. Hayom.
Hayom.
Shisha asar.
Shisha Asar.
Yeah.
Shehem.
Shnei Shavuot.
Shnei Shavuot.
Ushnei Yamim.
Ushnei Yamim.
LaOmer.
LaOmer.
So this is the third week of the Omer, making it a good day to drop some mushrooms. Why? Because it's about compassion.
It's never a bad day.
And empathy. Maybe not, but whatever technique or tool you want to use to deepen our emotional sense of connection with one another, interconnection with one another. That's the Sphira of Tiferet, of Rachamim, compassion. So today is the Gevura day of the week of Tiferet. There you go, Judith. We got in some Kabbalah.
Thanks, Jamie. I better head to the freezer before
Sometime I'll tell you about my experiences with an Indian mystic, where I did experience just from his touch, the altered state.
Wow.
And I learned a lot about Judaism from him.
Very cool.
Bryon, do we get a psychedelic goodie bag for
Steve, was there something you wanted to add?
No, I was just saying something funny. I said, thanks, Jamie. I better head to the freezer before the day's over. I'll miss the opportunity.
Well, you have all week. You don't have to do. It's what we have a whole week of Tiferet. All right. Thanks so much, friends, and say thank you again to.
Thank you.
Bye, buddy. Thanks for being here.
Thanks.
Thank you.
Thanks, Bryon.
Yeah.